Thank you very much, Mr. Under-Secretary General. I'd like to acknowledge the traditional custodians of the land on which this meeting takes place and pay my respects to their elders past and present. There are too many distinguished representatives here for me to acknowledge them all, but I want to pay special reference to three. To you, Mr. Under-Secretary General, Mr. Akasaka, for the Under-Secretary General for Communications and Public Information. I remember our meeting in New York at which the idea of holding this important conference in Australia was discussed, and I thank you for your support and cooperation since at that meeting and since that time. To my friend Mr. Michel Sidibe, Executive Director of UNAIDS, I thank you for your constructive cooperation since we first met in Sydney in 2007, when you were the Deputy Executive Director and I was the Shadow Minister. So we've both made significant progress since then, and I've appreciated the cooperation over the subsequent 3 years. And particularly also to Senator Helen Kroger, who is here representing the Leader of the Opposition. In Australia, we always have a tradition that we would have a representative of the opposition at such an important event, and of course it's particularly appropriate at the moment given the fascinating political situation which we've put on to entertain you. We thought you might not otherwise have enough to occupy your evening, so Sky News can entertain you. But also it's important, Senator Kroger's presence, because it symbolises the fact that you're not just welcomed here by the government, but by every Australian, and we're very pleased that you are here. Thank you very much. And to all the other distinguished guests from the United Nations, from international organisations, and Australian non-government organisations, welcome to Melbourne, welcome to Australia. As others have said, this is only the third time since 1947 the conference has been held outside New York, and it's the largest UN event ever held in Australia. So we're very pleased that you're here, and we consider ourselves a very appropriate choice for this year's conference, which precedes the UN Millennium Development Goals Summit that begins on the 20th of September in New York. We are the only major developed country almost completely surrounded by developing countries. The Pacific Islands to our east, Indonesia, Timor-Leste and Papua New Guinea to our north, the Indian Ocean and Africa to our west. Some of the most vulnerable and fragile countries in the world are in our neighbourhood. Their progress towards the Millennium Development Goals is mixed. We've made great progress, for example, in reducing malaria in Vanuatu and the Solomon Islands, and reducing maternal mortality in Nepal. But while this is welcome, we all know it's not enough. Our region, the Asia-Pacific, is home to 2/3 of the world's poor. Maternal deaths in the Asia-Pacific account for almost half the global total, yet the region attracts only 1/3 of total global aid. This conference is an important opportunity to bring our collective ideas and experience to bear on our shared global development challenges. You'll hear much from people much more expert than myself about health indicators during the conference, so I won't dwell on them now. The key message that I want to bring, and that I'm sure we all share, is that we are not making sufficient progress to achieve the Health Millennium Development Goals number 4, 5 and 6, nor are we giving sufficient attention to the rise of important non-communicable diseases which are not directly covered by the MDGs but which will impact on health outcomes throughout the developing world. Therefore, the theme of this conference, Advance Global Health, Achieve the MDGs, is very important and very timely. It's an opportunity to examine ways to make faster progress. There'll be an opportunity to feed the outcomes of this conference into the UN MDG Summit. And for Australia and our neighbours, it's also an important opportunity to raise awareness of the unique circumstances, needs and challenges of the region in which we are meeting. As we all know, in 2000, world leaders pledged to halve global poverty and agreed 8 goals to advance human development. And those MDGs agreed on that occasion have been important, obviously, because they represent an agreed global agenda. But I think they've also been particularly important as an excellent tool for explaining development objectives to the general public, which is vital if we are to maintain public support for ambitious and increasing ODA budgets in a time of overall fiscal stringency. In September, world leaders will gather again in New York to assess progress towards the MDGs. And we know we can expect a mixed report card. There have been gains and successes across the 8 goals, and these should be celebrated. But there have also been setbacks. For example, rising food and oil prices and the global economic crisis have had a big impact. The test for the international community is to identify ways we can move faster to meet the MDG targets by 2015. And each of us represented here has an important role to play in advancing these goals. It will necessarily be a collective effort. Governments can only do so much, and our decisions are necessarily shaped by many factors and players, including those represented here, and collaboration can result in more effective aid and greater harmonisation. For Australia's part, we're committed to being a good international citizen and to improving the lives of people less fortunate than ourselves throughout the world, but particularly in the Asia-Pacific region. We've committed to increase our spending to 0.5% of our gross national income. We're on track to achieve that. And it's important to note that at the recent election, this was a bipartisan commitment. Australians individually are generous. In 2008, the most recent figures we have, Australians donated over $800 million to aid and development organisations, and Australians are also very enthusiastic volunteers. Australian aid is centred mainly on Asia and the Pacific because of our geographic location. Other donors and UN agencies expect Australia to take a lead in this region, and we do, and we will. And there are big challenges, even where we are making progress. Maternal mortality rates in Nepal, Bangladesh, Cambodia, Indonesia have dropped significantly, but remain high. But those rates have actually increased in Afghanistan, in Fiji, in Laos, and remain persistently high in Papua New Guinea. In 11 countries in our region, at least 1 in 20 children dies before the age of 5 of conditions such as pneumonia, diarrhoea, and malnutrition. And we are gravely concerned about the progress for HIV, the prospects for HIV in our neighbourhood and in PNG in particular. Australia is also developing a more truly global program. We look west to the Indian Ocean, and we've increased our aid to Africa, and we have commenced serious engagement in Latin America and the Caribbean. In particular, we recognise the MDGs won't be achieved if we don't make more progress in Africa. We're therefore increasing our assistance to Africa in areas where we've particular skills and expertise. We have a track record of providing funding to, for example, the Fistula Hospital in Ethiopia, and some wonderful UNICEF programs I've had the opportunity to see for children who are orphaned as a result of AIDS. We are now committed to doing more in maternal and child health, water and sanitation, and agriculture. Australia's aid in Africa and elsewhere is delivered in partnership with the United Nations, with partner governments, with civil society and others to extend the reach and scope of our aid programs. We do this to better coordinate our aid and to maximise our impact. A range of partnerships are vital to our plans for an efficient and effective aid program. For example, we now have 9 partnership agreements with UN development and humanitarian agencies. We have Pacific partnerships for development agreements with 11 Pacific Island countries, and we've strategic partnership agreements with several major Australian NGOs. For example, we could not be doing the work we are doing and providing the assistance we are in Pakistan in response to the crisis outlined by the Under-Secretary General without the UN agencies and the NGOs with whom we are working. And we are committed to this partnership approach. It is central to the idea that we not only have to have a bigger aid program, we have to have a better aid program. It has to be efficient and effective. The Pacific Partnerships for Development, which we've developed, are a practical demonstration of that approach. And as recently as the 5th of August in Port Vila in Vanuatu, at the Pacific Islands Forum, Australia joined with other Pacific Island leaders in issuing what was called the Port Vila Declaration, calling on international development partners to work in partnership with the Pacific Island countries to help achieve the MDGs. These are new and positive ways Australia is working bilaterally, regionally, multilaterally to advance the MDG agenda and to meet the needs of developing country neighbours. These are some of our ideas, and we look forward to discussing them and your ideas in more detail over coming days. But ladies and gentlemen, let me conclude with this. This conference clearly comes at an important time. It's an opportunity to talk through big issues of global health and your ideas about the response to these challenges. It provides a platform to share ideas which can be taken to the MDG Summit. But it must be an opportunity not just for words, but for action. I wish you well in your deliberations. I urge you to make the most of this opportunity as we seek to build momentum for positive outcomes from the summit next month. Thank you.